Hi, my name is Jasmine Montanez, and I'm here to talk to you about cardiovascular disease prevention programs, or rather, access to cardiovascular disease prevention programs. Um, every year, the Centers for Disease Control estimates that about 650,000 Americans die of cardiovascular disease. What makes the statistic even more terrifying is that about 80% of these deaths are considered preventable. And about 1 in 4 Americans don't have proper access to clinics to gain access to preventative health care. Now, things like the Affordable Care Act that was passed did really great things like expand Medicaid so that more people can get access to coverage. And it also required that health insurance companies give people with pre-existing conditions coverage and they are no longer disqualified. But coverage does not always guarantee access to proper health care. The Centers for Disease Control have developed best practice guidelines that focus on things like education, home blood pressure management, access to better healthcare workers, and team-based approaches. And the American Heart Association has also tried to implement programs to increase the core infrastructures, activities, and resources to provide services for people who are at more risk. And while a lot of these efforts have done a lot of really great things to decrease the rate of cardiovascular disease mortality over the years, there's still quite a bit of things that needs to be done because healthcare tends to be uncoordinated and kind of fragmented, especially among poorer communities, especially among vulnerable populations. We have to consider the people who are really vulnerable, people that may be working 1 or 2 minimum wage jobs, that may use public transportation as their main mode of transportation. If we don't provide the clinics and the infrastructure to provide preventative services in their area, it is not going to be conducive to good health. And that's it.